A Lubbock cardiologist who previously paid more than $1 million to settle federal drug prescribing allegations is facing new punishment from the Texas Medical Board.
Dr. Juan Curdy, an interventional cardiologist in Lubbock, is accused of leaving a thin guide wire used in heart procedures inside a patient after a pacemaker surgery in 2022. According to the agreed order signed this month, the chest CT done right after the procedure showed the wire, but the board says Curdy relied on a radiologist's report and did not review the images himself. It was discovered a year later when the patient was in intensive care for septic shock from a urinary tract infection.
The board says this is not Curdy's first disciplinary case. In 2023, the board publicly reprimanded him and barred him from prescribing controlled substances after finding he diverted drugs and wrote false prescriptions for his own use. And last year, Curdy agreed to pay $1.2 million to resolve allegations he violated the Controlled Substance Act.
Under the new state order, Dr. Curdy must complete extra training on pacemaker patient management and risk management, give copies of the order to every facility where he practices, and he still cannot supervise physician assistants, nurse practitioners, or surgical assistants. Dr. Curdy neither admits nor denies the latest allegations, but agreed to the order to avoid further litigation.